and quarantine facilities, distribution of aid, and public transport are only part of the humanitarian assistance and disaster response mandate of the AFP. As such, Chief Gapay also said that they have deployed doctors, nurses, and other medical personnel among their ranks to various locations. And last, the Technical Education and Skills Development Authority, or TESDA, has been commissioned to produce 50 million pieces of reusable face masks to be distributed to citizens. TESDA Deputy Director General Aniceto Bertis said they have been directed to finish the mass production within 4 months, after which the masks will be turned over to the Interior Department and then the local government for distribution. And those were the main stories on the front page of the Philippine Star. Kung gusto po ninyong malaman ng kabuang mga balita, gusto ninyong mabasa, please go to the webpage of the Philippine Star. And I'm sure you can read all of that, including my column, which is entitled C-Talk in the Opinion page. Okay. Puntahan na po natin ang ating unang bisita kasi ang mga bisita natin today medyo mga busy mga tao. Let's bring in, naku, pag binasa ko yung buong pangalan niya, baka sabunutan ako nitong mayor natin, Maria Josefina Joy Belmonte, who has served as mayor of Quezon City. Mayor Joy, good morning to you. Nandiyan ka ba? Nako.
Sa lahat ng nanonood ng programa po natin ngayon.
Nako, parang ayun na. Ayun. Akala ko hindi mo na ako sasagutin, Mayor
Ikaw
Joy.
pa. Matagal na rin tayong hindi nagkikita, Cito.
Yeah, thank you, Mayor. Alam mo, kailangan konting biru-biruan ngayon kasi ang dami kong mga kilala, pati yung mga generation mo na mas laki ng bata mo sa akin, parang medyo nadi-discourage na and na bubugbog na sila sa COVID-19. Now, Mayor, how are you? I know that nagka-COVID ka din. Medyo nagpanic nga kami. Sabi ko, ano na nangyari kay Mayor Joy? How are you now?
I'm completely well and back to work. In fact, I was one of the 86% of the COVID positive patients that tested asymptomatic. So therefore, all I had to do was to stay home for the mandatory 14-day quarantine period, after which I went back to work, Cito, and I'm okay.
Okay, mabuti naman yan. That's good to know. Now, how are you in terms of running the city? Because, you know, just when I was going through the notes, I think many people missed the point that you are the executive head of the biggest city in the country. Hindi po biro yan with the population. How are things in Quezon City?
Well, with regards to COVID, Cito, to be very honest, we have 7,761 validated cases as of today. And, you know, the media always would like to say that Quezon City is the epicenter of COVID. Actually, that is not quite true, and I'd like to probably correct that wrong impression. While in terms of absolute numbers, I think we are currently second or third. In terms of per capita, that's number of incidences per million, which is how health professionals like to look at these health numbers. We are number 14 only in the Philippines. And that was from number 5 in April. So that means that we are actually managing our numbers quite well, given the current situation where there is a spike. And having said that, also, we are not that bad in terms of our health facilities, because the 3 local hospitals in Quezon City are not yet overburdened, given that they're not even 50% devoted to COVID, as is the rule of the DOH. They're something like 40-41, and yet we have available bed spaces there. We have enough quarantine facilities. None of them are full. We have currently 500. By the end of the week, we will be adding another 350, And we have recently launched a contact tracing team of about 700 contact tracers, forming 90 teams, And all of these people are out there contact tracing very actively. So I think that even if we are the biggest city, we have been managing quite well with regards to this crisis. No?
Okay, that's all good to know. Now, the question is, how does it affect Quezon City having all of the hospitals? Kasi parang kayo na yung parang pinakyaw nyo na lahat ng hospital ng Pilipinas. You have all the national hospitals, you have private hospitals, and people are asking me, Sito, nakaka-apekto ba yon sa number ng COVID cases ng Quezon City? I remember at the height of ECQ ba yon, na medyo nag-cordon off kayo ng mga ilang hospital kasi hot zones. How does all of this affect Quezon City, and what are you doing?
Well, there are advantages and disadvantages. Of course, the advantages outweigh the disadvantages in the sense na, syempre, itong mga national government hospitals na ito, malaki talaga ang naitutulong sa mga mamamayan ng lungsod Quezon. Halimbawa, yung Lang Center, talagang COVID hospital yan. Yung East Avenue Medical Center, sinabi ni Secretary Galvez, they will transform it into a COVID hospital as well. No? And we have maybe almost 20 national government hospitals here. No? So nakakatulong talaga sa amin. And it probably is one reason why our local run hospitals are not overburdened, no? Because ang daming ang national government hospitals, not to mention private hospitals as well. No? Pero yung disadvantage naman doon is syempre kapag nagkakaproblema din doon sa mga ospital na ito, katulad nung nangyari sa East Avenue, binanggit mo yan, noong April, kung saan medyo dumami ang kanilang mga cadavers, ganun din sa iba pang mga hospitals, kami rin ang tumututok dito. No? Kaya yan ang dahilan kung bakit we were the first city to have our own freezer vans. We had several here ready to take care of cadavers. I'm sad, I'm sorry to have to mention this, no, but this is part of being prepared. We also had a crematorium. We are the first, I think, city to have several, I think, 2 running crematoriums, no, to take care of these issues. And right now, there's a problem of accommodations for healthcare workers. Kami rin po ang tumutulong sa national government to help provide accommodations and transportation for their health workers. So, hindi naman disadvantage yun. We are happy to do that, no? Pero, syempre, nagtutulungan din kami dito sa Quezon City. And kami rin ang unang tinatakbuhan nila kung meron silang mga suliranin.
Okay, so there's a good side and a bad side to it. Pag meron nagkaroon ng skandalo o expose, akala nila Quezon City na, pero actually, it's an isolated case. Now, nabanggit mo, Mayor, in terms of millions, mas konti ang mga kaso dyan sa Quezon City. So it makes me wonder, paano nyo nakokontrol? Ilang milyon ba yung bilang ng tao sa Quezon City?
Sa present, Cito, we have 3.1, something like that, million people, no, sa latest census ng national government. So, pag sinabing cases per 1 million, meron kami sigurong 2,500, no. That's given the validated cases, no. Now, not too long ago, I mentioned sa dyaryo, sa media, na sana magkaroon pa ng mas maigting na effort on the part of the DOH to complete data gathering, no? Kasi marami rin kaming nakukuha na reports na taga Quezon City daw ang mga pasyente, pero walang complete addresses, wala ring complete contact details, pangalan lang. Tapos sinasabing Quezon City. And for me, that is a problem because we would like to contact trace all our patients here. Pero kung hindi kompleto yung datos, hindi rin talaga natin nalalaman kung ilan talaga ang tunay na mga COVID positive patients dito, at hindi rin natin agad-agad nako-contact trace yung mga nakasalamuhan nilang mga tao, no. So isa ito sa mga panawagan na ng lungsod Quezon sa DOH, no. So but having said that, given the validated numbers, again, we are only number 14 in the Philippines in terms of density. And I'm very proud of that because we've managed that status for the past, I think, 3 or 4 months. No? And in terms of recovery, Cito, many LGUs now are boasting of more than 50% recovery rate. Quezon City has already started, has increased its recovery rate to 60% since May, I think, of this year. No? So we're doing well in that regard as well.
Okay. ang mga tiga Quezon City ba napaka-cooperative o napakabagsik ba ng Quezon City Police, napakabagsik ba ng mga barangay captain? What's the secret? Kasi nung isang araw medyo ewan ko parang siguro nagbibiro o mali lang yung baka mainit lang ang ulo, nagsabi yung isang opisyal diyan na shoot to kill na lang ang makita sa labas na nagba-violate ng quarantine. Now, what is your secret for controlling? Because millions of people aren't easy to control in the biggest city. How do you manage it? What's the secret behind it?
Well, I think, Sito, una, no, I have adopted a policy of decentralization and empowerment, no, of our barangay officials. Kaya Quezon City ang pinakaunang lungsod na nagdeklara ng state of calamity bago pa man nagdeklara ng ECQ ang ating Pangulo, precisely because gusto ko magkaroon ng kapangyarihan yung mga punong barangay namin na magpasya patungkol sa kung paano nila i-address itong COVID situation sa kanilang mga lugar. I have to do this precisely because we are such a big city, and it is very, very difficult to centralize the enforcement if it's only the city government that will do so. So our barangays are very empowered. No, their BERTs, their barangay health emergency response teams, are very skilled and have been trained by us very early on in this crisis. No, and they have also been equipped with all the necessary PPEs, etc. No, and they are required to have their own quarantine facilities as well in the barangays. And we have put together all the protocols necessary, no, to make sure that while we are decentralized, that the way we operate is also according to standards and according to acceptable protocols and are uniform. No? In the early days, of course, kanya-kanya yung mga barangay. Nakikita naman natin na kapag nanghuhuli sila, hindi nila alam ano yung mga kailangan gawin, no? Dun sa mga nahuli nila. And that's why we have also passed several ordinances with regards to non-mask wearing, with regards to social distancing and mass gathering. So marami kaming napasang ordinansa. Ito yung mga gabay ng ating mga local government in terms of barangays, in terms of implementing or enforcing. Now, with regards to Task Force Discipline Head Ronilo, first, I'd like to say that what he posted, whether it was in his personal Facebook page, doesn't matter. It is inappropriate. It is unacceptable. It caused a lot of fear, and it caused a lot of apprehension on the part of our citizens. So that is really not something that is a policy of the local government. He did it on a personal, because of his personal feelings. But having said that also, many people were calling for his head, no? Kailangan tanggalin sa pwesto, etc. And ako naman, on a under regular circumstances, siguro yan nga ang gagawin natin, or siguro magpapataw tayo ng mga tinatawag nating disciplinary measures. Pero matagal ko siyang kinausap at sinabi niya sa akin, Mayor, sorry, he really apologized. He said, ito ay bugso ng damdamin. Talagang na-frustrate lang ako. Kaya na ilagay ko yan without thinking. Ito sa misstep. It was a lapse in judgment on his part. And upon validation, I could see where his frustration was coming from, Cito, no? Because based on our data, and this is hard data, I'd like to again tell you that I am always a data-driven local chief executive. I always look at the information. And based on our data on contact tracing, when we look at index cases of our hard lockdown areas, where we have now 11 or 12, ito yung mga talagang naka-lockdown, nakikita natin na yung index cases nagmumula sa tagay-tagay, inuman, nagmumula sa pagsasabong, nagmumula sa, again, hindi pagsusuot ng face mask, videoke, party, mahabang mga burol sa patay kung saan napakaraming siksikang nakikiramay. No? So nakikita naman natin na may batayan dun sa mga damdamin niya. So I am not justifying the post, but I am saying his feelings are probably understandable given the circumstances that he's faced. Again, I always say, people think that frontliners are just nurses, are just health workers, are just doctors, but the enforcers are also frontliners. In fact, their work is very difficult because they always have to balance between what is acceptable from a human rights perspective at saka yung tama naman na dapat gawin para talagang magkakaroon ng disiplina sa isang komunidad. No? So, mahirap ang kanyang trabaho at given that we live in extraordinary times, I decided against popular opinion na marami ring bumatiko sa akin bakit hindi tinanggal sa pwesto, katulad ni Senatora Risa Hontiveros, for example. No? Pero para sa akin, tama na nag-apologize siya, naintindihan ko siya, at I decided to give him a second chance. Because when you weigh things, Cito, if you take him out because of something that he posted that he did not mean to do, you will demoralize the troops. Kumbaga yung
Hindi.
mga nagtatrabaho, made-demoralize naman, di ba? So sabi ko, let's
Kanya,
balance it. Let's give him a
Kanya ko
chance.
kanya ko napangisi, Mayor, eh. Hindi dahil dun sa kay what's his name. Napangisi ako nung sinabi mong binabatikos ka ni Senador Risa Ontiveros kasi I think that's the irony of our situation. Meron ngang national official na nag-swimming kasama ng mga ng mga lumba-lumba ba tawag doon o dolphins. Hindi naman tinanggal. Merong nag-party, hindi tinanggal. Yung sa sobrang sama ng loob. I guess we're all so frustrated. We're all getting angry, and I think that's going to be our next battle. I don't know what your plans are in Quezon City because marami sa mga ordinaryong citizen, mga nakapag-aral, edukado, etc., parang nakakaligtaan na talaga, nakakaligtaan yung social distancing, bibisita sa kamag-anak, magpa-party, and then may bibilin lang ako, kuyang, and then pag uwi sa bahay, malalaman yung kausap nila, meron palang COVID. What is Quezon City planning to do in terms of educating people, because I think that's our weakest link. I don't know if you agree. Our weakest link right now is reminding people the lapses that they commit. Kasi ang ganda nung sinabi mo, Mayora, yung may nagsasabong, nagtatagayan, nagba-basketball pa, etc. What are your plans regarding that weak link?
Actually, Cito, no, we try to balance IEC or information and education campaigns with enforcement. So we have recently launched a campaign. If you come to Quezon City, you will see all over the city a big tarpaulins that say why I wear a mask. This is to get people to wear masks, no. And also, bukod dito, we strictly enforce yung iba't ibang mga minimum standards. So I have protocols for every sector, actually, no, from construction sites to call centers to supermarkets to malls. Napakalinaw na mga protocols na dapat ginagawa ng ating pong mga iba't ibang mga negosyo, iba't ibang mga sektor, transportation sector, etc. No? And it's not just protocols, we have formed surveillance teams. So may mga surveillance teams po ako na pumupunta sa mga construction sites, sa mga malls, sa mga retail shops natin, sa mga markets natin, just to make sure na sinusunod talaga itong mga protocols natin. But having said that again, Cito, yung apprehensions ng mga tao na papatayin sila, hindi po yan nangyayari. In fact, we don't even detain offenders because that will cause spread or infection kung sakasakaling may isang merong COVID sa kanila. So ang ginagawa po is when we apprehend, may lecture series, may nagtuturo, may nagbibigay ng iba't ibang payo, etc. Tapos we book them, we document them. Bakit? Kasi ito yung pinakaparusa na kung hindi kayo makapagbayad ng multa, which